Okay, here we go. And a 1, a 2, a 1, 2.
Welcome to Stony Brook University's Beyond the Expected podcast. I'm Michael Bernstein, interim president of the university, and your host of today's discussion featuring 3 members of our university community who are ensuring the health and safety of our students, staff, and faculty members. Let me take a moment to introduce our guests, and then we'll get into our discussion. First, welcome to Marissa Bisiani. Thank you for being here. Marissa is the Assistant Vice President for Student Health, Wellness, and Prevention Services. She develops and runs programs to help all our students achieve their academic goals while maintaining their health and well-being. Very important goal right now. Her role as a public health expert and lead administrator for prevention and spread of the COVID-19 disease, as we anticipated welcoming our students back for this spring semester, have been integral to our ability to respond to this current crisis. So welcome, Marissa. Rick Gateau is our Vice President for Student Affairs and the Dean of Students. Thank you for being here, Rick, and speaking with us about the effect of the virus on our student population and the steps the university is taking to address those concerns, as well as the unique challenges that you're facing on a daily basis, you and your team. And finally, Larry Zacharis is here, the Assistant Chief of our University Police Department. He is the Director of our Office of Emergency Management. Larry is an attorney, paramedic, volunteer firefighter. He has served in these roles for over 25 years. He brings a level of experience and competence to your work in the present crisis, which is unparalleled, and all of this amplified by training at the FBI National Academy in Quantico a few years ago. So again, welcome to all 3 of you. Thank you. Let's talk first about how the campus is responding to the unprecedented events and the crisis with which we're faced. I'll start with you, Larry. Certainly, we are in an emergency footing, an unexpected and unconventional one, to be sure. Tell us about your role in leading the campus response.
Well, thank you again for having us. And I just want to start off by saying that and you framed it very nicely, this entire incident is being driven by leadership, and your steady hand, which we're all grateful for, and that of the senior leadership team, because frankly, a good portion of what we're doing, the strategic direction and plans is coming from your office, as it should, and we're the players. And the analogy you were giving right before this began about us carrying the football down the field is apropos. So I want to thank you on behalf of everyone for that.
Thank you, Larry.
And that said, I think a good portion of our success so far is because of the time and effort that has been put into the preparedness and the planning around all of these eventualities. Perhaps not to the level of what we thought, but pandemic planning is nothing new, certainly for this campus and for higher ed in general. When I first began my tenure here in 2009, the version of COVID-19 was H1N1 back then, right. Certainly we'll get into, I know there are different questions about that, but our campus preparedness is, well underway prior to this, and even prior to my tenure.
And in your role, so you oversee a team, right, that actually responds in the eventuality of an emergency. But maybe just take a moment to tell our viewers and listeners about the preparedness you engage in. How is it that you lead emergency management as you anticipate possible challenges?
So from a higher level, from a 50,000-foot level, this is, pandemic is one of the many things that we prepare for. So everything from fires and floods and utility emergencies and IT interruptions and the active shooter preparedness on campus and all the things that anyone in the higher ed space has been dealing with or will deal with is in the portfolio of the broad-based, highly experienced team. There's not, team is the word we'll say over and over and over again. There's not one person. We're surrounded by the experts, and we're not afraid to call on them.
And you have a command center. Maybe you could tell people a little bit about that.
We do. So, after, again, lessons learned, you should always take the good, the bad, and the ugly after an incident. So after Superstorm Sandy, the administration at the time, rightfully so, realized some of our capacity issues, and we developed a dedicated emergency operations center and spent a good deal of time outfitting it. And that's where a lot of these decisions are being made. And we have using technology to assist us in running this incident and many others.
You mentioned Sandy, October of 2012. A big storm caused a lot of damage. A year later, there was a big blizzard, Nemo. I guess it was dubbed Nemo. I know you must be thinking about those past incidents as you're working the current challenges. There are some crucial differences, though, so I wondered if you wanted to reflect a little bit on what makes those incidents different from this one.
So, Sandy was interesting for us in that locally on the campus, we, for the most part, we're not totally impacted by the storm itself, although there were a cascading series of events of things that happened regionally that impacted us. We lost our internet providers because they all came through Lower Manhattan. We had a series of events that happened on campus. But those are sort of things that you plan generally, hurricane planning, and the things surrounding that. This is different. It's certainly different from H1N1. There being no current vaccine, and it's really it's a moving target and an evolving situation epidemiologically, and I think from a societal perspective as well. There's a lot of things that are different. Social media has evolved.
There's no social distancing for a hurricane. In fact, just the opposite. People tend to congregate and hunker down together to wait out a storm. And I'll just mention the other difference that's very, I think, vivid to all of us is, a hurricane has a beginning, a middle, and an end. You prepare for it, it hits your shores, it does whatever it's going to do, and then it's gone. Right now, we're struggling with the fact that we're anticipating, the peak of infections in this crisis, but we don't know how long that's going to last, what's going to happen, what's the end game, and I think those uncertainties are dramatic.
So, and to perhaps switch gears a little bit, being blunt and being honest, that the peak is ahead of us; it's not behind us, and we have been dealing with the current situation as well as preparing for unexpected eventualities where everyone, I think, certainly on this campus, but everyone in society will be doing non-traditional things in order to respond. And I think it's important that everyone understands that.
I want to shift now, talk a little bit about student affairs, student health. I will say, the best estimates we have, we were talking about this in a senior leadership team earlier today, 45 days, 50 days from now, we expect there'll probably be a peak in the impact of this pandemic, and it's going to be dramatic. And I know that fundamentally, Larry, you and your team, you're sort of paid to think the worst possible thoughts and prepare for them, and that's what you're doing. So it's very important. So looking at the student affairs and student operations, let's turn to you, Rick, first, and we'll bring Marissa in, obviously, from her important perspective. Student affairs is it's like one of the toughest jobs in the house, right? You're dealing with academic programs, you're dealing with dining, residence halls, recreation, health and wellness, student life, everything. And so here we are facing this unprecedented and in certain ways unknowable crisis. How are you making decisions, to address all of these nuanced student needs with respect to COVID-19?
Sure. So, we've been saying that if you look over the past week, it feels like it's been turned into 5 years, and things have happened at such a rapid pace. So I can say within the team and then our focus on students, obviously our primary focus is the health and safety of our students. That's the number one priority for our students in the campus. And I think it's clearly for our students, people left on spring break, I think thinking, what's happening? Nothing is changing in my life. I'm playing Frisbee outside and with my friends. And as each day has passed, I think as each hour has passed, more and more information comes out about processes to put in place, about advice, recommendations, urging our community, in particular our students, to take good care and to make sure that they are following protocols that we've put in place. And so as a community, this is difficult, but we yesterday made the decision to close the residence halls. To really try to reduce the density on our campus, because we know one of the pieces, and again, this is a new dictionary term we haven't heard before, but the term social distancing. And to make, and I for our viewers and people hearing us, I want to make it clear that that's such a critical piece of this. And we're doing everything that we can to tell students to stay 6 feet apart from others, wash their hands, really follow important health protocols, which I know Marissa will talk a bit more about. But I think for our students, it's probably just very jarring, because there's a fear and anxiety along this. Most of our students are in the 18 to 22-year-old. We do have some older students as well. But it's disconcerting to think that all of a sudden their academic experience has been interrupted and now we have to find a new normal. I think it's incredible if the academic side of the house, student affairs, have risen to the occasion. And this whole new virtual world, I think, in essence, this challenge has made us be more nimble, has made us be better be more creative, think about how we can serve our students well, and we're going to continue to do that because that's our job.
Well, I would second something you said, just the ways in which faculty, staff, and students have all pulled together. The community has pulled together. We get inquiries from the wider community. How can they help out? What can they do? We've had a remarkable commitment from a local family to provide funding to the hospital to help them, gear up, for the increased capacity they have to embrace. So, crises are tough, but they bring out some very great instincts in people. So, let's talk a little bit about student health. You've gestured toward that, Rick, in your comments. And so, Marissa, give us a picture right now. What's going on in student health services? I'm sure it's a pretty busy time. And, what are some of the key agendas you're pursuing with your team with respect to student wellness?
Sure. I mean, first I'll start off saying that it's been such a journey. It's changed. When we first started talking about COVID-19, we were screening students for travel. And now we're screening for students, were you exposed to an active case? So we're constantly changing our protocols. We're constantly looking at the guidance. But then one thing that hasn't changed is identifying students that have been exposed, identifying students that are potentially sick, and making action plans for them so that we can contain and we can make appropriate recommendations so that we don't spread this across campus. Again, talking about what Rick had said with this goal of social distancing and trying to decrease the occupancy across campus. So across student health services, we're really looking at students that are coming in who are sick. At the same time of this virus, we're managing that influenza A and B is also prevalent. So
yeah, it's flu season.
It's flu season.
It's flu season, right.
So now over the past 2 or 3 weeks, we've been fortunate that influenza A and B has kind of been decreasing across the state, but it is still there. So we have students that are coming in. We have students that are coming in, let's say, with just a cold, but they think they have COVID. Right. And then we also are managing through the student health service staff, but I won't say not also my counseling and psychological service staff, the fear and the panic and the anxiety.
You're seeing a spike in requests for counseling services, psychological services.
The fear of I was exposed to, not even I was exposed to someone who's sick, but I was exposed to someone who thinks they were exposed to the exposed to the exposed, the second and third removed. Sure. So we've been doing a lot of education. We've had to change, again, our protocols, so we're constantly keeping intact and in touch with what the regulatory guidance says. But on top of that, we're also having to readjust how we do our operations because we have to respond to the campus community. So we've done some creative things, and I guess we'll go through that later about how we've done staffing. And I've taken a nurse, let's say, off a regular schedule just to answer these type of community questions because so many questions are coming in from not even just students, but also from parents.
Yeah, very good point. Let me just emphasize, and I want to pursue you and Rick on one thing here. Almost on an hourly basis, the campus is receiving input from various regulatory bodies, the State University of New York system offices in Albany, the governor's office, obviously, in Albany, at times the federal government, the Centers for Disease Control. Who knows, we may start hearing from the National Guard since they're being deployed to lend assistance. So, and I know that Larry and his team, they're hearing from local law enforcement, the county police, the state police, whatever. And we have to respond to these things quickly. You're there trying to formulate a response to student health needs, for example, Marissa, and at the same time we're getting guidance about how to deal with these needs because they've shifted something or the governor's put out an order or whatever. So I'm curious to ask you, Marissa and Rick both. So what's changed in your daily routine, right? I mean, you come in every day, you're running student wellness, you had a routine. Rick, you had a daily routine. What's changed?
Well, I just want to point out, my cell phone is not on my person for the first hour in the last.
And you look very anxious. I know you're very anxious.
We're actually hoping it's a 6-hour podcast.
This is we're trying to disengage him.
Right.
But the word that struck me as you were speaking is ambiguity, and I think that this is true for faculty, staff, students, parents, all of our stakeholders and community members, because as was mentioned earlier, it's not an event like a hurricane where there's a beginning, middle, and end, and then there's some cleanup. Here it is ever evolving, ever changing, hour by hour, and so part of what we need to do is help make sure, and with ambiguity comes the requirement to do good communication. And I think I can speak within student affairs, our academic partners, parents. We've done everything we can to keep people up to date in as much as possible. I know on our coronavirus website that communications is doing a fantastic job managing our FAQs. We say they change every half hour with new updates, new guidance, new information. So as a source of information, we want people to get consistent, and I would argue factual information too. There's a lot of misinformation that gets spread, whether it's through other social media posts and we want to make the point that go to our website as the main resource of information, because that's where you're going to get the facts. And clearly the guidance from the CDC, the Department of Health, our professionals in the field, those are the ones that we're relying on for the most critical information.
Yes.
Go ahead, Marissa.
Oh, no, I just wanted to say, in terms of being very nimble, that's the one thing I think that has been prevalent amongst all of us being administrators. A key component outside of student health is our employees, because now with the media playing a role in this, they're starting to get this fear and this panic amongst employees, faculty, and staff.
Sure.
So we're also managing that component as well as our personal lives, being spouses and being
that's
parents.
right.
So I think that's what I think we all could probably say in this room. We've learned to be nimble and be flexible and managing all that. But I think that's the role we take as providers as well as
Given the work you do.
administrators.
That's
Exactly.
right. Yeah, that's what we signed on for.
Yeah.
I'd like to, talking about the students, I mean, an interesting aspect to the Stony Brook experience so far is that we actually took in 26 students on behalf of the State University of New York who traveled home from Italy, a country a couple of weeks ago identified by the U.S. Department of State as a so-called level 3 country, at which point the State University of New York senior leadership said, we need to get these students home. Then the question was, well, they're coming home from a level 3 country. We have to quarantine them for the recommended 14 days. And these students have ended up in quarantine on our Southampton campus, where we had some dorm capacity to do that. And in a way, that puts Stony Brook in front of any other campus in the SUNY system, and quite frankly, many, many campuses across higher ed in the United States in terms of dealing with student quarantine. And all of you have been involved with this. So the students predominantly came from Italy, I think a smattering from South Korea. I would emphasize, I think only one of them is a Stony Brook student.
That's
Yes.
correct.
The rest of them are from other
That is
SUNY
correct.
campuses.
Absolutely.
Again, we'll start with you, Larry, on this. You were instrumental in developing a plan for these students, and this came out of nowhere, right? This was one
Literally
of
out of
those
nowhere.
quick changes. We got to house these students. Tell me how you formulated that strategy and, dealing with student needs, and of course the surrounding community, which also had to, be engaged about this issue.
And so, without sounding repetitive, but I will say that, we touch on the expertise that we have, and we very early on identified that we want open thinking, we want group think, but we also need people to operate within their lane, because that's your area of expertise. Logistics and putting it all together and coordinating that with SUNY, local emergency management, state emergency management, that's on my shoulders, but we would parse out the individual things. So, okay, we're making originally space for 36 people, so we need 36 of everything, 36 fridges, 36 microwaves, 36 laptops. But then Rick's team and Marissa's team, all of the other little pieces that go along with that, and then the reality of having to support that in the most unconventional, non-traditional way, where we're telling people you're going to stay in your room for 14 days. So somewhere along the line, people are asking, okay, what's the plan, or where's the checklist? And I turned to Rick at some point and I said,
right.
we're writing the checklist.
I just say, and I want to hear more from Rick and Marissa about what's happening with the Southampton students. You make a really good point, Larry, about people staying in their lanes. If you've ever coached Little League, right? The kid comes up and hits a ground ball, and all of the infielders rush to the ball. And the coach is there, no, hold your positions. Let the particular player make the play. Let the shortstop make the play and get it to first base. Holding position is a big issue of coherence among our teams, and it's sometimes hard to maintain, because people are, they want to help out. They're anxious. They want to deal with it, but then we get in each other's way.
And frankly, honing that and refocusing perhaps to... It's a balance between letting people know that you're not working within a silo, but that you appreciate their experience, while also managing personalities, managing all the different pieces. So that's a...
So looking to Southampton, Marissa and Rick. So first of all, tell me, how are the students doing there? Right there, what day are they in?
They're doing. I think they're a day 9.
Yeah,
right?
9 or 10, right?
Right.
So
So,
they're- okay,
a group of
good.
students, they will be very happy when they are able to depart. Most will be departing on March 21st, this
Yes,
Saturday.
this Saturday.
And a few a couple days later, based upon the date of the
So
quarantine.
what's their life like down there? What's going on?
I think that you could
Yeah,
add,
sure.
but so we have, Student Affairs is a great team, and we really prepared prior to make this as comfortable as possible. So we have healing arts and crafts in there. We have Zoom sessions in there. We've done as much as we could to make this as simulated as comfortable as possible. We've had some people call it Hotel Southampton, I'll just say.
We're afraid they may not want to leave now.
Uh-oh.
We've had people ask us if they could join in on Southampton. You want to add to
Yeah,
that?
and again, this is a great example of true collaboration and it all coming together literally in a matter of probably 24
Yes.
hours. And it was really incredible. And I wanted to give a shout out to some individuals. I mean, Campus Dining has been amazing. I mean, basically every student can go online and order their food. It's delivered 3 times a day. The Southampton team has done an amazing job. We actually set up, which was again, thinking back in your life and saying, okay, what are things that have happened that are of a similar nature of a crisis, and how did we manage it? And so we set up a student affairs liaison with every single student. So there's a daily check-in. The staff's been amazing day and night. They have their cell numbers. They're FaceTiming with the students and keeping in touch with them. It's really heartwarming.
And it's great to hear. And Larry made the comment. I mean, making sure that everybody's connected. If they don't have a laptop, they have a laptop. That they're able to engage.
And even the
digitally.
broader Stony Brook community. I mean, people from Ollie Knitting Club, other people have given in, goodie bags, care packages. It's just been really incredible. And as you said, only one of the students is from Stony Brook. The rest, most are from FIT, and they've been wonderful partners. They've been incredibly grateful for everything. We had a Zoom session. Wolfie showed up. It was really it was very, very nice. So
great.
I shared with the students when we had the Zoom session. I said, look, I know this is a challenge for all of you to be in quarantine for 14 days, but I said, when you all apply to graduate school, you've just written your essay. So it'll be
point.
an amazing experience. I said journal their experience, because I think one woman said she's going to write a book someday. So
Marissa, has there been a particular claim on counseling and psychological services from this group of students, or is it?
So I will tell you what we
the
did.
normal distribution.
Well, what we did was, again, we geared up prior. So when we thought about a quarantine, there's a couple of things we thought about. We thought about the psychological impact. So we made available that every student there would have access to telecounseling. So that was available to them from the moment they entered into there. They had access to how to implement that service. So no delays. We also had a physician in Student Health Services that would make a call to them every single day, and it was actually more than once a day, to monitor symptoms. And also that was done in collaboration with another physician through our local Department of Health. And then we also put quarantine infection prevention guidelines in place for them, because I don't want to minimize. I mean, yes, we're saying it's fun and there's Zoom, but the bottom line is you're in one place for 14 days, and we don't want to forget the reason why we're doing this. And the reason is so we need to provide a safe environment to monitor, because these students are asymptomatic. We're watching to see if they're going to develop symptoms of COVID-19. So once they do, we need
So that's a little anxiety producing
You
in and of
got it.
itself, right? I'm being watched to see if I'm going to get sick,
You
right?
got
This is
it.
not a good thing.
Every day you're taking your temperature twice a day, you're watching and you're waiting, and that can be anxiety provoking. So, there's conversations that happen with the students, and we did have some of those experiences where students were getting a little anxious that even a mild cough or even a sniffle, they were thinking, is this COVID? What's happening to me? So we've had just not even so much that we had to implement telecounseling, but just do some through the liaison work or just through the physician that's working with them, just some coaching and some conversation with them to talk through. We've had some conversations with their parents to kind of help them through this. And it's active, it's happening. I think it's been a great experience for us, because if we were to have something like this on East or West Campus where we had a positive student that was in the residence hall, it gave us a great opportunity to think about how we were going to implement these infection prevention strategies.
So you've anticipated me, because I wanted to sort of shift from Southampton to the general campus. So tell us a little bit about, what are the processes, protocols you've started to develop in the residence halls? And just to review something Rick said earlier, we did notify the campus community yesterday that we were, quote unquote, closing the dorms. We're not closing the dorms. We're telling all students capable of leaving to leave. It is in their best interest to leave. We know that there are students who will not be able to leave, whether because they're international students who cannot travel or other students who do not have homes to which they can go at this time. We, of course, will keep those students. Our goal was to lessen the residential population, and we're establishing the protocols, to determine who's who. But this must then confront you, both in student wellness and student affairs, with, okay, what are the protocols for the remaining students?
Absolutely. I want to stress that this was not done because of an absence of protocols. We've had protocols in place for several weeks. We've been working with a hospital. We've had those protocols that if we had a person under investigation that was a student, we were able to transport them to the hospital, and we had that communication. And we also had a plan in place that if we had to quarantine one of our students, we could activate that very quick. So that was never the question here. Why we did this was purely to follow the guidance of the health department and local regulations to do the social distancing, to do what was asked upon us, to not have social crowding.
And I just, to give our viewers and listeners a sense of the dimensions here, we had talked about this in the senior leadership team this morning, a bit over 10,000 students and residents. When we started spring break last weekend, we ended up with 6,000. Right. People enjoy being on campus. Our goal is to try to get to about 2,000 or a few more than that, because that we think we can manage, right?
Right,
with respect to an outbreak.
The potential, this is the thought process where we are today, is that as students move out, and part of the reason why we were putting really a 48-hour window for students to leave is that we don't know if there will be travel restrictions put in. So we want to make sure if students want their belongings, that they know there's a sense of urgency to do so. If they're not put in, then that's good, in terms of some, ability for people to come get things, but we just wanted people to know how important it is if they want their possessions. And then the goal would be, we have an amazing facilities team to go in and then help clean the spaces right away that are vacated, with the ultimate goal to have people be in as many single room spaces as possible, which again is part of the guidelines, as well as then have as few people access one of the same bathroom on the floor, and then constantly keep that bathroom clean. Again, Southampton's been a great model for us in terms of actual protocol, because in that example, we have 2 students using one bathroom, but only one at a time. There's a knocking system. We really worked very hard, kept cleaning supplies, which I think, again, helped keep people safe. So this may take some time, but once we have most students out, have moved out by this weekend, we anticipate then working through that over the next week or so. And then really being at the ready with the dining services, and the campus residence teams doing amazing work on very short notice to get people moved out. So again, I think we're taking the right steps to keep everyone safe.
And I would also add, again, we were reviewing this in the senior team meeting earlier this morning. To the extent our medical facilities get outstripped in terms of capacity, the campus is well poised to provide space and opportunity for additional capacity, whether it's to treat patients or to house people or whatever, including staff who may be needed. So I think that everything you've done in student affairs has been exemplary in terms of obviously serving the needs of our students right now, but also in putting us on a footing we most likely need to be on in terms of what's coming in the weeks ahead. Let me turn back to you, Larry. Speaking again of preparedness and emergency protocols, I mentioned at the top of our session that you have extensive experience in law enforcement and extensive training. So maybe you could tell us a little bit about how that experience and the training has prepared you for what you're managing right now, what you're leading us through right now.
Well, I can tell you this: I've had a blessed career, a very privileged career. I've worked in a lot of great places with a lot of great people with a lot of different experiences. But this is the, I think, as you mentioned earlier this morning during the senior leadership meeting, this is a defining moment in all of our careers, and how we're responding to it will be looked upon later on in retrospect. This has pulled from every experience that I have had in the law enforcement world, in the EMS world, in the emergency management world, every piece from health and human services to security to forward thinking. And to Rick's point before, and we've all experienced this, we will walk into a meeting drafting an email or drafting a strategy, and because of all those moving parts, when we think we're done, we're getting ready to send an email to do that, and then we find out that some guidance has changed or some things have changed. This is the most dynamic situation, I think, for all of us. So having had the training and the relationships that we have, fantastic relationships with our local partners, police, fire, EMS, emergency management, state and local partners. You know, there's an expression in my business where you should never be meeting the leader of the other agency at the scene of the fire. You should never be shaking hands for the first time when it happens. So, and just this morning on the way in, you know, a silly request. We needed a pickup truck in the south parking lot to move something from one place to another. The person who's on site, the site manager from the State Emergency Management Office, and I known each other for 20 years. We have those relationships, and that goes for everybody. We know who to pick up the phone and who to text or who to call just to get things done, and we're just getting things done. So I think a lot of it certainly is experience, but those networks are being put into play.
And it's a really important point. And again, Larry, you've played a crucial role in establishing all those links of communication between our campus and, you know, local agencies, state agencies, national agencies. That's been crucially important. I think a big challenge must be the fact we train for things by looking at the past. So, you know, when you were doing your emergency management training, I'm sure you were looking at lots of case studies and reports, and we do this in student affairs, and we do it in student health, and we do it in academic affairs, and we do it in management. But then you're confronted with a new situation, which is not retrospective, it's new. And we have to be careful not to be fighting, you know, the old saying, not to be fighting the last war. This is the current war we're fighting.
This is the, and I hate to use the expression, but I'll use it anyway. This is the 9/11. This is the Virginia Tech. This is the Hurricane Katrina of our time. We're handling it. We're managing it. But when we look back, we will put it in that category. Certainly not in the loss of life and things like that.
Hopefully not.
I want to be clear about that. But in the amount of resources that's going towards
Right.
this.
And again, you alluded to this, Larry, in our senior team meeting this morning. I mean, this has changed all of our experience, all of our roles at the university, whatever roles we're in, and including the roles of all our staff colleagues and faculty colleagues and the students. It's changed their lives. I shared with the team a message from a senior I received overnight who's struggling with, you know, what it means, what's happening to her senior year, right? And a lot is happening to her senior year that we wish had not happened. So speaking of the students again, you know, we've got a huge team of faculty leadership, deans, vice provost, the provost himself, and of course, Rick and his team dealing with the changing experience of our students. So we're making this big transition to online classes. It's our goal when we come back from what is now an extended spring break, and at the moment we project that to be March 30. We'll resume instruction March 30. That's what we're projecting at the moment. Maybe you could talk a little bit, Rick, about your experience with the team and with the other leadership and academic affairs about this transition, what you're hearing from students in particular. We know what we're hearing from faculty, and faculty really are working hard to try and make this happen. It's hard, but they're working on it really day and night.
I mean, and so on the faculty point, it's an opportunity again for faculty to be creative. And you know, the word was used about being nimble. And I sometimes in my higher ed career, I've said higher education is not nimble. In moments like this, you're forced to be nimble. And this thought about moving to online education, we're fortunately in a good position in that the university several years ago through summer and winter courses have increased the online offering. So I think there's certainly a core group of faculty who do have experience in that. Our CELT team within DoIT, they've really done amazing work in terms of working to help transition face-to-face courses, in-person courses to the online environment. I do want to point out Larry Zachary's himself teaches in the higher education administration program, crisis management and prevention.
I owe you a syllabus.
And in fact, his course is transitioning from face-to-face to online as well. So he's in the heart of it as well. I think for students, again, many of them have actually taken online courses. Kind of adaptability with technology has been a benefit. I have heard from some students that I didn't come to Stony Brook to be an online student. That is a challenge. It's a transition. But again, I think with all the work that's being done, this new normal will settle in. It'll take a little time. We'll settle in for students. What's really important for all of us is, I think, for the faculty and staff and administrator end, is to make sure students' experience feels seamless. And that while the transition happens, I'm going to call it there's a hiccup, a bump in the road that's happened now for the last few weeks. By March 30th, the goal is to be at a position where you're back in your academics, because I also think it's true for just students' psychological well-being, all of us. We do need to get back into a routine. And March 30th is hopefully a bit of a reset button for a new routine to carry us through the last 6 weeks of the semester.
This touches on something Marissa said early in the conversation about uncertainty and unanticipated events. I think sitting in uncertainty is a very uncomfortable place. Speaking for myself, but I think we all feel that way. We're hearing this obviously from faculty and staff colleagues who are uncertain about next steps and what's going on. Obviously, our community partners, all of us are, consumed with uncertainty about what the future will bring and the course of this pandemic. But among students, and this is, I think, part of what we're hearing. I didn't come to Stony Brook to be an online student. It's sort of dismay that something's gone away that they cherished, their student experience. It's changing, but we don't know exactly how that's going to play out. And so I'm just curious, Marissa, about, there are, I guess, emotional and mental impacts of this transition. There are obviously the pedagogical impacts. We need instructors to get their pieces online. Hurry up, Larry. And all of the technical issues around standing up platforms for online delivery. But then there's this emotional aspect. So I'm sure maybe you're hearing more about that too in student wellness, yes?
There are. So there's a lot to say about that. So I wanted to add a couple of things. I wanted to just tag along what Rick was saying, that we do have our Student Accessibility Support Center. So anyone who's having accessibility needs, they can always move over to that area. Right. In addition to, let's put counseling in one side, but I want to also say that the beauty of having through Rick's leadership of having me oversee health and wellness is I also have areas that think of health and wellness as recreation. So what we've been doing is trying to build for our students virtual ways to recreate. So they're actually out there trying to think of ways to move counseling to, we have like these Let's Talk stations where they used to have a counselor be out in the community and do face-to-face sessions. So they're moving that to an online virtual platform. So even if a student necessarily isn't on site at campus, there may be a way that they can do this type of work. And when we talk about the emotional aspects of, like, let's say quarantine, we talked about these students in Southampton that had to quarantine for 14 days. But now we have our own. We have our own students of Stony Brook that may be having to do this, and our own faculty and staff.
That's right.
Whether or not they were exposed. They're doing this just because they're having to do it, because they can't go to a restaurant and sit and eat. They can't go and do their usual routine. So some of the things that I know that my counseling center is really emphasizing, and all my staff are emphasizing, is trying to really think about what does this mean for them, and maybe trying to simulate the things that they used to do, putting that back into their daily routine. So if they normally had their coffee break at 11, try to do that at home. If you
right.
Take the coffee at 11 a.m. or trying to put that in, but also don't lose aspect that this could be opportunity to slow down and maybe do some of the things that you had on your to-do list that you'd never had a chance to do. The things that always used to maybe provoke a different type of anxiety, that you might get a different type of relief. So maybe you want to tackle that closet that you couldn't tackle, or
that drawer in the kitchen that's full of everything unorganized.
Something.
Right?
It could be an opportunity, and I know that may sound crazy to some people, but there's always some way to try to make light of a very dim situation. And again, this is outside of the personal things that we may be dealing with if we have a loved one that we're worried about in health and wellness. I'm thinking about trying to go back to the student that you were talking about, thinking about graduation and how am I going to cope with the changes in my life, and trying to shift that. So I think that the Counseling and Psychological Center is working and thinking about those things, but also they're managing the students and the concerns that they have for students that are missing their families.
It's interesting because you're pointing to the opportunity to teach students a bit more about resilience, adjustment, nimbleness, as we've talked about. Tough lessons under very pressured circumstances none of us would have wished for. But it is that opportunity. I mean, I'm really struck by that, and I keep thinking about that message from the student overnight. And we will answer her gently, but also say, look, nobody wants these circumstances, but you can extract from this some positives. And as you say, maybe changing your routine, trying a new routine that you never thought you could have before. and maybe recognizing that just by trying something new doesn't mean you have to do it forever, or doesn't mean that you have to do it for a very long time. You're just trying it for a few minutes or what have you.
Yeah. Or even taking some aspects of the old routine, like I said, the coffee, and adding
Right.
it might give you some feeling of normalcy.
But I sense, though, I mean, in listening to you, Marissa, and to you, Rick, that our students grew used to routines that were face-to-face, if you will, brick-and-mortar routines, right? I mean, I've even noticed this myself, stopping into your favorite coffee shop in the morning, not only to get your coffee, but to say hello to people that you've developed a kind of relationship with, not doing that anymore, right? And that, suddenly there's that void in starting your day. And I think it's going to take some effort and thought. How do we recreate that for students?
I think so. The transition is certainly one piece, but I also want to add as well, in terms of looking at this as a situation on our campus, it certainly has reverberating effects in other parts of lives. And these may be things that are short term, but we've already heard of cases where a student's parent may have been furloughed. So then there's a financial issue now. A family member is older and at home, and they may be ill, and they don't, they're staying away from their family. I called my own parents and said, "Don't go outside."
Right.
It just out of concern. And so it's trying to figure out, again, thank goodness for technology today, because if we didn't have what we have today, we would not be able to function. So I think we're using technology to our best advantage to maintain contact and communication. We also, as Stony Brook, we're also about community. And I think that's really an important part of what we do. I know the students, you mentioned earlier today about, commencement and graduation. And I think we all remember back to our own graduations. It's such an exciting time in this momentous occasion where everyone's celebrating. We have so many first-generation college students. This is their first student graduating. So we'll figure out ways to make it, an experience that they won't forget. Really, we will work on that. And but I do also think as well that for our seniors and graduate students who are also looking to enter the workforce, we now need to continue to work with those students in critical ways to really market our students well, because given some of the economic downturn, again, certainly short term as we hope, that may affect some hiring. And so we need to be conscious of how we ensure our students are the best prepared for that next adventure.
I think and I know for sure that the student affairs and student wellness teams are engaged with this, but we will have the opportunity to engage students in their input about how this makes them a unique class. I'm thinking of the seniors now. Sure. They will be forever a unique Stony Brook class, the class of 2020, and they, again, not circumstances they would have chosen, but the circumstances with which they're confronted, and that will give them a unique identity that they can brand themselves to. So I think there is opportunity there. While we feel we're in totally unprecedented circumstances, and we do feel every day brings a new set of challenges that we didn't anticipate. I mean, Larry did mention earlier there have been other episodes that have challenged our university in very dramatic ways. There are the meteorological episodes, the hurricanes, the snowstorms, and there were also in the past epidemic, not pandemic, challenges. You mentioned H1N1. There's also the so-called MERS outbreak, the Middle East Respiratory Syndrome outbreak. So I'm wondering, Larry, if you could reflect on your experience with those epidemic episodes and what you've gleaned from them, what's been useful in thinking about them, and quite frankly, what are some of the negatives? Some of the things, wouldn't do that again, or we want to avoid that this time around.
And so we have obviously a unique advantage with Stony Brook Medicine being on our campus.
Academic Medical Center right here, absolutely.
Plugged into all the experts and the resources associated with that. In 2009, H1N1 again was a different disease entity and a different from a host of reasons. We were one of the first in the county to actually get vaccines, and we stood up one of the first, if not the first, points of distribution pods on the campus, such that it was modeled elsewhere in the county with all of our own staff and student volunteers. Again, unprecedented, no real checklist doing that as a model for it, but we cut our teeth with that model. And I think all of the lessons that we had. So when we started planning for this, I went back to all of those old notes and folders, and we brought up the same model because it worked very well then, identifying all of the constituencies that we have. I mean, the whole broad spectrum, academics, IT, athletics, you name it. they had a seat at the table from our planning perspective, as well as the morning. I know everyone's getting tired of them, but our morning senior executive team, whereby strategies and decisions come from the highest level, and then they're executed by the planning folks. It worked very well then, and I think it's serving us very, very well now.
I think one thing I'm always struck by in any of these episodes, the relatively minor ones of the past, which seem minor now. I know Sandy wasn't minor when it happened, but in relation to what we're anticipating here, it does seem of smaller dimensions, or H1N1, or a snowstorm. You realize that there are so many moving parts in the response to these challenges, and that's why getting that team around the table. I know everybody's exhausted 8 a.m, they're dragging themselves in, but when you get everybody, or they're coming in on Zoom now, it doesn't matter, you got to be awake, and so there you are around the table, and from a 360-degree perspective, you're getting all of the different points of view on a particular issue: housing students in quarantine, going online for instruction, making sure there's adequate supplies and facilities to respond to needs across the campus, food supplies and so on. And getting everybody around the table, you start to see things that you didn't realize before, and how one thing affects another. And the complexity of it is really part of the most daunting.
Yeah, and frankly, we had, again, a pretty good model, but along the way, we even realized a few things that we hadn't thought of then. On the fly, we adjust. Hey, so you know what? We need that expertise. Bring that person into the fold as it continues to be extremely dynamic.
Let me turn the frame. We have a few minutes left. Let me turn the frame to the three of you personally. Just obviously you've been living in the center of the storm, literally. Larry, our emergency management maestro, and Marissa and Rick, leading our response with respect to the needs of one of the core, not the only, but one of the core constituencies of our university, our students. Big part of what makes us a university. So I'm sort of wondering, what you're all going through. How have your routines changed? What are you learning so far? Maybe even, what do you wish you knew before this started that now you know? I know there's a lot of self-reflection going on, but I think our viewers and listeners would be interested about what's going on with you, since they know the extraordinary and also the very, very pressured roles you're playing right now on behalf of our university.
You'll start, May.
Please do.
Thank you for asking, President Bernstein. It's very nice that you asked. I don't know how important it is, to be quite honest with you, because we're doing this every day. It's what we're meant to do. It's why we're here. I'm a mother of 3. I really think what's changed for me is with the H1N1, I was kind of a new mother. I was working in employee health services. It was quite different. We had a vaccine. We actually had a medication, Tamiflu. And back then, I was prophylaxing employees who were exposed. There was no shortage in PPE. So I think for me, I feel it differently. I think I've historically I've worked as a board-certified nurse practitioner. So I've been a healthcare provider before I've been an administrator. So I see it from many different angles. And I also see it personally from an angle as being a mother. So I see patients as being employees, I see patients as being students, and I see patients as being my children. So personally, I'm tired.
I bet.
And I'm managing being all those different people. And I think I'm starting to feel it emotionally for our healthcare providers. I think I'm looking forward to the government giving us more supplies for our PPE for our healthcare providers. I think that is the number one priority, and I think that that's something that needs to happen soon. So I think that's where I am emotionally.
So I've been described as the Energizer Bunny, and
Yes.
I don't ever sleep.
Actually, long before this happened, I might add.
I think back over higher education career and examples of crises that we've managed, and this obviously is a one-of-a-kind situation. But I will say it helps people rise to the occasion. And the idea of having to think on your feet, being creative, being innovative, figuring out how best to communicate, having to learn new things immediately. I sometimes relish in that pressure to do that. I think it's actually exciting. And I, as you were asking the question, it just made me think about it's the word team. And this does take a village. We all have to follow. And this is a village even in the entire community. Again, referring back to social distancing, washing your hands, all the protocols in terms of making sure that you wipe spaces down, that you keep distance. I think we're a culture that is used to socializing and hugging and engaging and shaking hands. And it's very hard to say now that has to come to a stop. And so it takes a village to help reduce the potential threat. And we'll do it. And we're going to work together as a team. I am so proud of Student Affairs and the entire university for coming together. We have a long road ahead of us, but we're going to get to a better place. And I keep telling the team, better days will be ahead of us. It'll just take some time.
Yeah, and I people keep seeing me, running around saying, "How you doing? How you doing?" And I've been waiting my whole life for this. I've been planning. I've been training for this forever.
Hey, I understand the context.
I know you do. That's why.
Okay. Only an emergency management leader could say this.
Right.
But personally, I would say, my wife works in organ procurement, organ donation. So and we have 4 kids. This is certainly different than things in the past, and she kind of gets it. So having that support at home is helpful, very helpful. I'll just say this as a last for anyone listening. Take a breath. We're going to be okay. We're all going to get through this.
Well, you've anticipated. That was we have just a few minutes left. What do you want to share with our viewers and listeners as we conclude this conversation today? Larry, you've just started with some advice.
There are people like us all over this country working around the clock to ensure the safety and health and safety of their individual constituency. It's no different here. We're going to get through this. We're going to be okay. It may be different, but we're all going to be okay.
Oh, I have something to share.
Yeah, please.
Follow the advice. There's a reason why the restaurants are closed. There's a reason why we're asking you for social distancing. So if there's students that are listening and you think that it's okay to still hug and kiss, and you think it's okay to still have the parties, and you don't want to cancel, events, it really is important you do that. It's the importance of the safety for yourself, but also important for the safety of loved ones. So please take this seriously because we need to slow down the transmission of this virus.
No comment. I'm going to say ditto to what my colleague said. I feel the same.
I think one thing worth emphasizing in the observations you've all just made is obviously we have new protocols and practices, as Marissa's indicated, to protect people. We don't want people to get sick if that can be at all avoided. But I also think we should remember right now, as I understand it in what I'm reading, I'm not a physician, but what I'm reading and what our colleagues in the health sciences are telling us, about 80% of the population, when exposed to this virus, will not develop serious illness, and in some may not develop any illness at all, and certainly will move forward and hopefully develop antibodies to this thing, whether they're lifetime or not, I don't know, but it's the 20% we're worried about.
Yes.
And we know that for the 20%, this is a dire situation, and for far too many of them, I'm sure in the end, when we reflect on this, it will be a fatal encounter. And the whole point of these protocols and processes and procedures and the warnings and wash your hands and social distancing and don't hang out at the restaurant or the bar is so that those 20% will have access to the services and the treatment they need. Because if all of us are clamoring forward to be tested and, we think we might have it. Marissa was mentioning earlier, somebody gets a cough, suddenly they think they have a dire illness. That will clog our healthcare network to the point where they can't respond in an effective fashion to the overwhelming need that's coming. As we talked earlier this morning, it's a harsh image, but it's a real one. A wave of illness is coming our way over the next 6 weeks or so. And we want to do whatever we can to meet the needs of the people who need it the most. So for those of us who will be blessed and not need it, we need to get out of the way. And that means doing the right things so that our healthcare providers and our healthcare system, overstretched as it will be in a position to provide that kind of care. Any other thoughts any of you care to share as we conclude our conversation today?
I think I just want to say that I think as a university, we will continue to communicate, the factual information as it happens. Please, work with us and make sure that that you're reading the website, you're learning information, that you're following directives and
The
advice.
information is changing all the time.
Correct,
So
right,
people
right,
should keep
right,
checking that all the
absolutely.
time.
Especially the FAQs. There's a lot of information in the FAQs on the website.
Right, and the FAQs, the frequently asked questions on the website, they are being added to and revised, as Rick and I just said, regularly. So you want to keep touching base with them.
Oh, there is an employee health information line for West Campus and Health Science Center and FSA employees. There will be one set up very shortly for East Campus employees, but for the other employees I just mentioned, that number is 632-5000. There is a dedicated nurse answering that line. You just leave a message and they can answer your questions about exposures and what to do regarding quarantine.
And I'm glad you mentioned that, Marissa, because I meant to draw you out about that earlier, but our conversation moved in a slightly different direction, that your work is now expanded to help with employee health.
Yes.
Obviously you're focused on student health. That's your billet, but at the same time now we're very concerned that our employees, faculty and staff, have their questions answered, have some access to support, even though they may have their own healthcare providers and so forth. All of those networks are overstressed, so we're trying to provide whatever support we can.
Yes.
Larry, any last thoughts you have as we conclude the podcast?
As I mentioned this morning at the meeting, this is it's not a sprint, it's not a marathon, it's a triathlon. So everyone just needs to pace themselves, and we're going to get through this.
Well, I want to say, first of all, I want to thank all three of you. I know you're very busy, and as Marissa has reminded us, you're all exhausted too because you're going 24/7. No, seriously, self-care is important, right? And at the same time, you're doing a remarkable job. And you've taken time here to allow our listeners and viewers to get a sense of how we're framing the response in not only to a very complicated and challenging situation, but in a very complicated and challenging context. A big university it's a world, and it has, as we've said earlier, lots of moving parts. I would emphasize I'm privileged to be able to see this from a 360 degree, 64,000 foot level, whatever metaphor you want to use. And what I am struck by is by the incredible resilience and solidarity of the Seawolf Nation, the Seawolf family. And it's remarkable. Rick noted this at the top of our conversation. People are pulled together. They're solution focused. They're trying to get forward to the best possible outcomes, all committed to serving our communities and, of course, to sustaining our university. So, again, I want to thank all of you, and I want to thank our viewers and listeners. Thanks for spending time with us on Beyond the Expected.